Hello, everyone. My name is Mace, and I'm a volunteer with SHINE, which is an acronym for Servicing Health Insurance Needs of Elders. And on behalf of myself, SHINE, Elder Source, and the Department of Elder Affairs, we welcome you to today's presentation of Medicare 101, an overview of the A, B, C, and D's of Medicare. Online meeting etiquette. Please familiarize yourself with the Zoom menu options. Please hold any questions, and with time permitting, I'll be glad to answer them for you at the end of the presentation. Elder Affairs. SHINE is a program of the Florida Department of Elder Affairs, DOEA. The SHINE program is part of the nationwide State Health Insurance Assistance Programs, SHIP. There are SHIP programs in all 50 states and 4 U.S. territories. The Florida Department of Elder Affairs receives annual funding for the SHINE program from a federal SHIP grant. The Florida Department of Elder Affairs vision is for all Floridians to live well and age well. SHINE's mission is to provide free and unbiased health insurance counseling through a dedicated network of volunteers, empowering Florida seniors to make informed health care choices. Disclaimer. SHINE is a free program offered by the Florida Department of Elder Affairs in partnership with your local Aging and Disability Resource Center. Specially trained volunteers can assist you with your Medicare, Medicaid, and health insurance questions by providing one-on-one counseling and information. SHINE services are free, unbiased, and confidential. SHINE is not affiliated with and does not endorse any insurance company or product. Area Agency on Aging, AAA. The Department of Elder Affairs administers programs and services for elders through contract agreements with the 11 areas agencies on aging, AAA, in Florida. The AAAs are independent, not-for-profit organizations responsible for ensuring the availability of services to all elders in Florida. The SHINE program contracts annually with the area agencies on aging to provide counseling services locally. SHINE counselors. The primary duty of volunteer SHINE counselors is to help Florida seniors identify, understand, compare, and/or enroll in original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance, Medigap, low-income subsidy, extra help for prescription drugs, Medicare savings programs. SHINE counselors also provide counseling for long-term care planning and assist clients with Medicare complaints and appeals. Through the SMP grant, SHINE counselors can provide education on Medicare fraud and abuse, including how to protect yourself from fraud, how to detect fraud, and how to report fraud. Introduction to Medicare. The following slides present an introduction to Medicare. Introduction to Medicare. What is Medicare? Medicare is a federal hospitalization, medical, and prescription drug insurance program. Unlike many other types of health insurance programs, Medicare benefits cannot extend to a spouse or other dependent. All eligible people must be enrolled individually if they want Medicare coverage. Medicare was created by Congress in 1965 as Title 18 of the Social Security Act under President Lyndon Johnson. Medicare became effective July 1st, 1966. Medicare is the nation's largest insurance program covering nearly 50 million Americans. There are 4 million Medicare beneficiaries in Florida. While Medicare is administered by the Centers for Medicare and Medicaid Services, CMS, the Social Security Administration, SSA, is responsible for enrolling most people into Medicare. The Railroad Retirement Board, RRB, is responsible for enrolling railroad retirees into Medicare. Introduction to Medicare. Parts of Medicare. Medicare has the following parts. Part A helps pay for inpatient hospital stays and also helps cover eligible skilled nursing care, home health care, and hospice care. Part B helps cover medically necessary services like doctor visits and outpatient care. Part B also covers some preventive services, including screening tests and shots, diagnostic tests, some therapies, and durable medical equipment like wheelchairs and walkers. Part C is another way to get your Medicare benefits. It provides Part A and B coverage and often Part D prescription drug coverage. Medicare Advantage plans are managed by private insurance companies approved by Medicare. These plans must cover medically necessary services. However, plans can charge different co-payments, co-insurance, or deductibles for these services. Part D. Medicare drug coverage helps pay for outpatient prescription drugs. Medigap. Policies are insurance policies sold by private insurance companies to fill the gaps in original Medicare plan coverage. Medicare eligibility. There are only two eligibility requirements for Medicare: citizenship and age. Both have exceptions. Other factors may impact a person's cost under Medicare, but they have no impact on Medicare eligibility, including current health condition, employment history, Social Security, FICA contributions. A disability is a physical or mental medical condition that has prevented someone from working or is expected to prevent someone from working for at least 12 months or end in death. To be eligible for Medicare under a disability, the condition must meet Social Security's criteria, and the individual must have been receiving Social Security Disability Income, SSDI, for at least 24 months. End-stage renal disease, ESRD, is permanent kidney failure that requires a regular course of dialysis or kidney treatment. Amyotrophic lateral sclerosis, ALS, is a disease of the nerve cells in the brain and spinal cord that control voluntary muscle movement. Medicare enrollment. Medicare enrollment is facilitated through the Social Security Administration. It can be done online at ssa.gov. It used to be that most people began receiving Social Security when retirement benefits when they turned 65 and were automatically enrolled in Parts A and B by the Social Security Administration. Since Part B has monthly premiums, some people choose to opt out if they do not need the coverage. Now, most people delay signing up to receive Social Security retirement benefits until after age 65, so they can get the maximum benefits allowed. Therefore, they must voluntarily enroll in Medicare when eligible. Individuals can enroll in Medicare during their initial enrollment period. which spans the 7 months surrounding their 65th birthday. Alternatively, they can enroll during the general enrollment period, which takes place annually from January 1st through March 31st. In certain cases, individuals may qualify for a special enrollment period, which allows enrollment due to specific circumstances, such as losing coverage due to an event outside of their control or moving out of the plan's service area. Since Part B has monthly premiums, some people choose to opt out if they do not need the coverage because they are still working and have coverage through their employer. Introduction to Medicare. The effective date of Medicare coverage is based on when you enroll. Enroll within 3 months prior to your 65th birth month, the effective date at the start of the 65th birth month. Enroll during the 65th birth month, effective start of the following month. Enroll 1, 2, or 3 months after the 65th birth month, effective start of the following month. The best time to enroll is during the 3 months before turning age 65. If the initial enrollment period is due to 24 continuous months of Social Security Disability Insurance, SSDI, enrollment in Medicare is usually automatic. Original Medicare. The following slides present information on Medicare Parts A and B. Medicare Part A. Not all charges incurred during a hospital stay will be covered by Part A. Only those that are billed as part of the hospital's standard inpatient care. Other charges may be covered under Part B. Medicare Part A only covers patients that have been formally admitted into a hospital and are receiving inpatient services from a hospital that accepts Medicare. Medicare Part B. Medicare Part B covers most outpatient services, as well as hospital charges that are not billed as inpatient care, usually with a 20% coinsurance. Part B also covers emergency room treatment. Except for emergency rooms, Medicare will only cover services rendered by a provider who chooses to accept Medicare. Original Medicare Parts A and B. Original Medicare is fee for service. Medicare pays as services are provided. People in Original Medicare may go to any doctor, specialist, hospital, or other health care provider that accepts Medicare. Original Medicare Parts A and B. Part A. While most people don't pay a premium for Part A, they are responsible for a Part A deductible for the inpatient hospital stays. The deductible is the amount a person with Medicare must pay for health care before Medicare begins to pay. There is a deductible per benefit period. A benefit period, spell of illness, begins when a person starts to receive Part A covered services and ends after 60 consecutive days without Part A covered inpatient care. Original Medicare, Parts A and B. Part B. People with Original Medicare are also responsible for some co-payments, a dollar amount, or coinsurance, a percentage amount, for Part B services. The amounts depends on the service, but it is 20% in most cases. People who choose Medicare Part B usually have the premium automatically taken out of their monthly Social Security or Railroad Retirement Board payment. Medicare sends a quarterly bill for Medicare Part B premiums to people who don't get a Social Security payment. Medicare sends a biweekly bill for Medicare Part B premiums to people who do not receive a Social Security payment. The invoice can be paid by electronic funds transfer, credit card, check, or money order. Note, everyone is charged a monthly Part B premium. While Social Security cost of living adjustment, COLA, was low, a statutory hold harmless provision designed to protect seniors will largely prevent Part B premiums from increasing. For most beneficiaries. For 2025, there is an increase in the Social Security benefits. However, the hold harmless and not hold harmless amounts are the same. Shine handout. Many of you are here today because you would like to save on the out-of-pocket cost of Medicare and prescription drugs. We will discuss two cost-saving programs known as Medicare Savings Programs and the Extra Help Programs. Here is an example of the Medicare Prescription Drug Options 2025 handout that can be obtained by calling your local Shine office. Medicare Supplement Insurance. The following slides present information on Medigap. Medigap. Original Medicare pays for many healthcare services and supplies, but it doesn't pay all of a person's healthcare cost. A Medigap policy is supplement insurance sold by private insurance companies to fill the out-of-pocket gaps in coverage under Original Medicare, such as deductibles, co-insurance, and co-payments. The insurance companies that sell these policies must follow federal and state laws that protect people with Medicare. The Medigap policy must be clearly identified as Medicare supplement insurance. A Medigap policy only works with original Part A and Part B. If you join a Medicare Advantage plan or other Medicare plan, your Medigap policy by law cannot pay any deductibles, co-payments, or other cost sharing under that plan. Medigap plan types. A Medigap policy must be one of 10 standardized plan types so people can compare them easily. Each plan type has a different set of benefits. The benefits in any one Medigap plan type are the same for any insurance company. It's important to compare Medigap policies because cost can vary. Note, insurance companies don't have to offer every Medigap plan type. Each company decides which Medigap policies it will sell and the price for each plan with state approval. Plans F and G also offer a high deductible plan. If you select the high deductible option before your Medigap plan pays anything. Part B coinsurance, plans K, L, and N, will require you to pay a portion of the Part B coinsurance and copayment, which may result in lower premiums for these plans. All other Medigap policies pay them at 100%. Not all types of Medicare policies may be available in all states. Medigap eligibility and enrollment. People under age 65 with ESRD may not be eligible for Medigap insurance until they reach age 65. Florida law requires insurance companies to offer Medigap policies to people under age 65 with ESRD. Anyone with Parts A and B are eligible for Medigap. While people with original Medicare Parts A and B can purchase Medigap policies at any time, they may not be covered by guaranteed issue right and therefore may be required to pay more for pre-existing health conditions. The best time to buy Medigap is during the Medigap open enrollment period. Medicare Advantage plans. The following slides present information on Medicare Advantage plans. Medicare Advantage MA plans. While original Medicare Part A and Part B, perhaps with the optional Medigap policy, are one way to get Medicare coverage, people may choose instead to enroll in an all-inclusive Medicare Advantage plan. Medicare Advantage plans are also known as Part C plans. It's important to note that people who join a Medicare Advantage plan are still in the Medicare program, still get all their regular Part A and Part B covered services, still have all Medicare rights and protections. Medicare Advantage MA plans continued. Medicare Advantage plans are bundled policies. Members usually get all of their Medicare covered health care under that single plan, including hospital, medical, and prescription drug coverage. People may have to use specific doctors that accept the plan or go to certain network hospitals to get covered services. Because all Advantage Plan members are still receiving Medicare coverage, they are responsible for paying the Part B premiums. Depending on the specific Advantage plans, members may have to pay other costs, such as additional premiums, co-payments, or co-insurance for their covered services. The plan may offer extra benefits such as coverage for vision, hearing, dental care, or health and wellness programs. Medicare Advantage MA plan types. There are 6 main types of Medicare Advantage plans. Health Maintenance Organization, HMO plans. Members must generally get health care from providers in the plan's network. Members have a primary care physician who must pre-approve all referrals to a specialist. Some HMO plans offer a point of service option where members go to doctors and hospitals that aren't part of the plan, but it may cost more. HMO point of service, HMO-POS plans. Similar to HMO plans, HMO-POS plans provide some coverage outside of the HMO's network with the probability of a higher cost. Preferred Provider Organization, PPO plans. Similar to an HMO plan, but members can see any doctor or provider that accepts Medicare and do not need a referral to see a specialist. Going to a provider that is outside of the plan's network will generally cost more. Private fee-for-service plans. Members can go to any provider that accepts the plan's terms and they may get extra benefits. The private insurance company decides how much it will pay providers and how much members pay for services. Special needs plans limit all or most of their membership to people in certain long-term care facilities like a nursing home who are eligible for both Medicare and Medicaid, or who have certain chronic or disabling conditions. Special needs plans are available in limited areas. Medicare savings account plans have two parts. One part is a Medicare Advantage plan with a high deductible, and one part is a Medicare savings account into which Medicare deposits money that people can use to pay health care costs. If used for medical expenses, the money is tax-free. It's very rare. Prescription drug coverage. The following slides present information on prescription drug coverage. Prescription drug coverage. As we discuss Medicare Part D, there are several important things to keep in mind. All people with Medicare who are eligible to enroll in a Medicare drug plan, people who live outside the U.S. or who are incarcerated are not eligible to enroll in a plan and therefore cannot get this coverage. People must be enrolled in a plan to get Medicare drug coverage. This is not automatic like A and B. Medicare drug plans are offered by insurance companies approved by Medicare. There are two types of Medicare Part D plans. PDP, a standalone prescription drug plans add coverage to original Medicare and some other types of Medicare plans. MA-PD. Most Medicare Advantage plans, like an HMO or PPO, include prescription drug coverage. Plans vary by coverage, cost, convenience, and customer service, and financial extra help is available based on income and assets. The term Medicare drug plans is used throughout this presentation to mean both Medicare prescription drug plans and Medicare Advantage plans with prescription drug coverage. Medicare drug plan cost. Costs vary depending on the plan. For coverage in 2025, people will generally pay a monthly premium, which varies by plan. Some plans have zero premiums. Others have higher premiums but might offer more coverage. Most plans fall between $30 and $60 per month. An annual deductible is the amount plan members must pay for prescriptions each year before the plan starts to pay. These amounts can change every year. Some plans offer a zero deductible, usually for a higher premium. No plan can have a deductible higher than the standard amount. Co-payments or co-insurance. This is the amount plan members have to pay for each prescription after meeting the deductible, if any. In some plans, the co-payment, a set amount, or co-insurance, a percentage of the cost, is the same for any prescription. All plans must assign a tier for each drug on their formulary. Once a beneficiary reaches the $2,000 out-of-pocket cap, they will automatically get catastrophic coverage. This means that they will not have to pay out of pocket for covered Part D drugs for the rest of the calendar year. The amount people pay in some plans may vary depending on how much they have spent that year. Under the standard benefit, Once the deductible is met, members pay 25% coinsurance until they reach catastrophic coverage. (2025) prescription drug coverage. Medicare prescription drug coverage is divided into three phases. 1. Deductible. Beneficiary pays 100% of drug cost until the deductible is met. The deductible may be zero. It cannot exceed the standard amount shown. It begins January 1st. 2. Initial coverage. Beneficiary pays a coinsurance, 25% is standard, and the plan pays the remaining balance. Begins when the beneficiary's drug costs reach the deductible amount. The plan pays up to 75% in this phase. 3. Catastrophic coverage. Begins when the beneficiary's out-of-pocket costs reach the amount shown. Includes manufacturer's discounts on drugs. The beneficiary pays a 0% coinsurance for generic and brand name drugs or a small copayment, whichever is greater. The drug plan is liable for 20% of the cost. In a standard drug plan, Medicare subsidizes 80% of the cost for catastrophic coverage. This is called the reinsurance subsidy. Note, coverage percentages may differ for individual beneficiaries and plans. New in 2025, enrollees who need expensive medication should also be aware of the new option starting in 2025 to spread out their drug costs in equal payments throughout the year instead of having to meet the $2,000 out-of-pocket maximum in the first few months of the year. Selecting Medicare coverage. The following slides present information on prescription drug coverage. The internet is full of information about Medicare. Not all of it is accurate. This is the official website for Medicare. It should have the most up-to-date information. The information contained on this site is deemed accurate and reliable. Like most websites, the layout and appearance of this site may change in the future as it is updated by CMS. The Medicare.gov Plan Finder is a great way to see what Medicare plans are available in your area and help you decide which is best for you. Shine. Contact a Shine representative for assistance in selecting the best Medicare coverage for you. Financial assistance programs. The following slides present information on financial assistance programs. Shine handout. This helpful Shine fact sheet lists the eligibility requirements for financial assistance programs for which Shine counselors may help beneficiaries apply and can be obtained by calling your local Shine office. Medicare Savings Programs, MSP. The Medicare Savings Programs are part of the National Medicare Program and are designed to help beneficiaries with income that does not exceed 135% of the federal poverty level. Asset limits also apply. The federal poverty limit, FPL, can change every year. The QMB, SLMB, QI1, and QDWI programs are collectively known as the Medicare Savings Programs, MSP. Extra help with prescription drug cost. Depending on a person's gross monthly income and assets resources, they may be eligible for reduced Part D insurance premiums and deductibles and will only have to pay a minimum amount for their prescriptions. Certain people automatically qualify for extra help and do not need to apply. These include people with Medicare and full Medicaid benefits, including prescription drug coverage as referred to as dual eligible. People with Medicare who get supplemental security income, SSI benefits, but not Medicaid. People who are enrolled in a Medicare savings program. People who meet their medically needy share of cost at least once during the calendar year in Florida. People who qualify still need to join a Medicare drug plan to get extra help paying their prescription drug cost. If they don't join a plan on their own, Medicare will enroll them in a plan to ensure they have coverage. Medicare will send them a notice telling them what plan they are in and when their coverage begins. They can only change plans one time per calendar quarter in the first 3 quarters of the year. Other people with Medicare should file an application with the Social Security Administration to find out if they qualify for extra help. They can apply with Social Security online at ssa.gov. Medicare fraud and abuse. The following slides present information on Medicare fraud and abuse. Medicare fraud and abuse. The difference between fraud and abuse is intent. Now, let's learn the 3 most important steps that will prevent you from becoming a victim of Medicare fraud and abuse. 3 steps to prevent health care fraud. So, what can you do to take charge and help prevent Medicare fraud, errors, and abuse? Consider ways to prevent yourself and others from becoming Medicare fraud victims. Detect Medicare fraud and abuse. Even when you do everything right, there is a chance that you could be a target of health care fraud. If you detect or suspect fraud or abuse, report it. You will protect other people from becoming victims and help save your Medicare benefits. 3 steps to prevent healthcare fraud. Prevent. Here are some tips to protect yourself from healthcare fraud. Treat your Medicare card like you would a credit card. Only share Medicare cards and numbers with trusted resources who need that information to serve you, i.e., doctors, pharmacies. Do not rely on advice or offers from unknown persons who call, visit, or approach you in public. Never sign a blank medical or insurance form. Detect. Medicare sends you 2 notices with your claim information. The 2 notices are the following: Medicare Summary Notice, MSN, and Explanation of Benefits, EOB. These notices allow you to review your Medicare claims and check for possible mistakes. Report. If you see something unusual on your MSN, check with your plan or call Shine. If you get a call from someone requesting your Medicare number, do not give it out. call the Federal Trade Commission at 877-382-4357 and your local law enforcement. If you believe you are a victim of fraud or abuse, contact your local law enforcement and Shine for more information. Prevent. Medicare loses approximately $60 billion each year due to fraud, errors, and abuse. Due to these losses, CMS has developed a new Medicare card. This card replaces your Social Security number with a Medicare beneficiary identification number. There are still opportunities for fraud and abuse if a fraudulent party has the new card. The new card is sent to an unfamiliar address and is used by a fraudulent party. Or if personal information, such as a SSN of bank account numbers, is shared with a fraudulent party. Prevent. Fraud protection tips. Treat your Medicare card as you would a credit card. Share Medicare cards and numbers only with trusted sources who need that information to provide services to you, i.e. doctors, pharmacies, etc. Don't rely on advice or offers from strangers who call, visit, or approach you in public. Never sign blank medical or insurance forms. Detect. There are two notifications you can receive from Medicare. One is the Medicare Summary Notice, MSN, and the other is the Explanation of Benefits, EOB. Both notifications should be reviewed to verify that they do not have errors. Your MSN is sent by Medicare every 3 months. You may choose to receive Medicare Summary Notices electronically, EMSNs. If you choose this option, you will receive a monthly email with a link to your claims information. You must be receiving monthly EOCs from your prescription drug plan and or your Medicare Advantage plan. Report. If you see anything unusual on your MSN, check with your plan or contact Shine. If you receive a call from someone asking for your Medicare number, don't disclose it. Call the Federal Trade Commission at 877-382-4357 and local authorities. If you believe you're a victim of fraud or abuse, contact local authorities and Shine for more information. Red flags on an MSN. Your Medicare Summary Notice, or MSN, is very useful for detecting fraud. Let's review the 5 highlighted sections that will help you check for fraudulent Medicare charges. Number 1, your visit. This section provides information like the date you went to your doctor. Keep your bills and compare them to your notice to be sure you got all the services listed. Number 2, service descriptions. User-friendly service descriptions will make it easier for you to know what you were treated for. Number 3, approved column. This column lets you know if your claim was approved or denied. Number 4, max you may be billed. This is the total amount the provider is able to bill you. It's highlighted and in bold for easy reading. Number 5, notes. This section refers to explanations of your services as listed at the bottom of the page. Next, let's look at the sections highlighted in red for examples of what to specifically check for. Is this a provider you know? Did you receive services on this day? If you live in Connecticut, did you really receive services in Ohio? Do any services appear twice when they shouldn't? Questions or comments? Please hold any questions or comments until the end of the presentation, and with time permitting, I'll be glad to answer them for you. Shine. Shine counselors offer free and unbiased assistance to help seniors identify, understand, compare, and/or enroll in Original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance policies, Medigap, Medicare prescription drug low-income subsidies, Extra Help, Medicare savings programs, long-term care planning, insurance and financing, other public and private health insurance. Contact the local Shine program. Elder Source. The local PSA 4 Shine Contact in Jacksonville, Florida is Elder Source, located at 10688 Old St. Augustine Road, Jacksonville, Florida 32257. The phone number is 888-242-4464. Tell us how we are doing. Please complete a short survey at the URL listed here, tinyurl.com/survey for Shine, and tell us how we are doing. End of presentation. Lastly, on behalf of myself, Shine, Elder Source, and the Department of Elder Affairs, we appreciate your time and participation in today's presentation. We hope this presentation has provided an insight into becoming better educated to better assist you with your Medicare endeavors. Thank you.